What are the most common symptoms of breast cancer? It is very important for us to know the symptoms so that whenever we observe any change, we are immediately able to access the correct treatment and we are able to consult our doctor so that we can tell them about the changes that we notice, and if there is any abnormality, it can be detected at the earliest. So to know, the most common symptoms include, the first is the size, shape and texture of the skin that has changed. So when we talk about the size, it means in general terms it is a fact that one of our breasts is a little bit larger than the other one. But if you see a massive difference in size, that means there is some abnormality. Now when we talk about the texture, our skin starts to look like an orange peel. So it's also called as the puckering effect. So if you notice any such changes in your breast, that means it is a matter of concern. Now if we talk about the nipples are inverted, it moves towards the inside, and also there is nipple discharge. So what I mean with nipple discharge is that it is for women who is neither pregnant nor breastfeeding. So if you are someone and you still feel there is a discharge from your nipple when you are not in any of these conditions, you are neither feeding your baby or not pregnant, then it is a matter of concern and you should address it immediately. Also, the most common symptom is a lump. There is a thickening in the breast, there is a lump that you can feel. So if there is any hard knot that you feel in your breast, it is a matter of concern and it should be addressed. So lump, as I have told in my previous videos, not all lumps are cancerous, but it can be due to various other reasons. But a lump is currently a sign, a major symptom for which you should definitely consult an expert at the earliest. Now, there are two most important questions that are asked very frequently. If you have any of the symptoms, does that mean you have cancer? No, it is not true. Not all of these symptoms confirm that you have cancer, but yes, these are warning signs that you definitely need to go and consult with an expert so that if there is any abnormality that can be cancerous, can be potentially detected through other diagnostic tests. And also, there are some people who ask us questions like, if I have neither of these symptoms, does that mean I'm free from cancer? That is also not a correct thing to say, because there are situations when you feel no symptoms at all. There are particular cases when there are no symptoms that are seen to our eyes, but it does not mean that you cannot have cancer. So regular screenings, what we say as mammography, is very important. Both clinical evaluation and diagnostic evaluation play a major role. So understanding the symptoms and acting accordingly is very important. And at the same time, once you understand the symptoms and you take care of yourself, you do a self-examination, it is also at the same time very important that you do not miss the monthly mammography that is told to you in a regular period of time. So that gives you a detailed information about your breast and how it can be prevented from cancer.